So tonight's an opportunity for us to reflect on the last year and to look forward to the next year. We've put together a programme of live presentations and some pre-recorded videos to give a flavour of the many, many different things that have been happening over the last year. This year we've had a particular focus on access to our services, including primary care, mental health and our specialist services. And a big thank you to everyone who's taken part and contributed to the work this evening. First of all, I'd like to thank this evening's production company, who are Drop the Mars Productions, who are a community interest company, a not-for-profit organisation specialising in IT and media services for the third sector, and also concentrating on employment and training for people with lived mental health experience. So many thanks to them. This year, my thoughts remain with all the many people who have faced challenges this year, brought on by the instability and uncertainty that have impacted so many of our different communities. The rising cost of living has brought further hardship to often already hard-hit communities, and we are working very hard to try and address the already stark health inequalities that so many people experience. And it's important to remember that these difficulties have come at a time when our society and the NHS are still recovering from the effects of the pandemic, and the demand for care continues to increase since the pandemic. And I have to give a huge thank you to all 6,500 of our staff for your incredible response to the demands and for the compassion that you've maintained throughout these most difficult times. The trust has made progress in our journey to improvement is wholly down to you in work, and we thank you. All of you are fantastic staff. I'd like to also thank my colleagues on the Trust Board for their leadership, support and challenge to ensure we remain focused on what matters most to the people who work with us and also to the communities that we serve. We've had some changes on the Trust Board, and I'm delighted to welcome Eugene Jones, who's joined us as our Chief Operating Officer, and Dr. Satnam Sidhu, our new People Officer, who you'll hear from a bit later on this evening. Also, Dr. Kevin Cleary, who has joined us as a Non-Executive Director. I would also like to thank some of our colleagues who've moved on for their significant contributions, not least Paul Drake, our previous Chief People Officer. And again, thanks to Kerry Salmon, who stepped up and was acting Chief People Officer until Statman joined us. Also, we thank Rebecca Diana Eccles, who is with us this year as an Associate Non-Executive Director. And I thank her very much for her advice and support in this time. Just recently, our Chief Medical Officer, Dr. Steve Tompkins, has taken the decision to retire, and I'd like to thank him for his hard work and commitment during his time working with us in the Trust. We remain immensely grateful to Adrian Thorne, our lead governors, and indeed to all of our Council of Governors who bring their knowledge and representation of local people, staff and communities to help us continuously improve. As many of you know, we are working together with colleagues across Hampshire and Isle of Wight to create one integrated community and mental health trust. And I'm delighted to say that Lynn Hunt's been appointed as chair to lead the trust through into this new organisation, and also that Ron Shields has been appointed as chief executive of the new organisation, and we'll be hearing some more about that later this evening. And most importantly, I'd like to thank you, our communities, the patients who use our services, their families and carers, for all the time and effort you put into helping us improve and the feedback that you give us. We are committed to constantly responding and improving to become the best that we can. I hope you enjoyed this evening, and we welcome any questions that you may have. Now, I would like to introduce you to our lead governor, Adrian Thorne, and two of our other governors, Venus Muddens, who's Public Governor for North Hampshire, and Sarah Reid, who's one of our staff governors for South West Hampshire. for their reflections on this year.
Thank you, Jenny. Good evening, everybody. My name's Adrian Thorne, and I'm the lead governor for the Trust. I want to welcome you all to the annual members meeting this evening, and hope that you have a very enjoyable evening. It's my pleasure today to introduce two of our governors who are going to talk to you about their experiences as governors. I'm going to start off with Venus, and then we're going to move on to Sarah Reid. I very much hope you enjoy what they've got to say to you. Venus.
And thank you, Adrian. So my name is Venus Madden, one of the public governors for North Hampshire. I'm really pleased to see the ongoing work happening at Southern Health Trust. There are lots of challenges, but the Trust continues to ensure people first. And by people, I mean patients, carers, volunteers, as well as staff. My observations are mainly via committee meetings and a couple of in-person events that were organized for the public. I really appreciate how the staff who lead and facilitate the events always ensure accessibility. For example, how they share information, making sure that they meet the accessible information standard, the way they deliver the workshops, and how they make sure venues are always accessible to all. With the diverse population we work with, I would like to see more events designed and organized for minoritized communities, raising awareness, empowering them, and actually tackling inequalities further together. Thank you very much, and I now pass you to Sarah.
Good evening, everyone. My name is Sarah Reid, and I'm the Staff Governor for South West Hampshire. I'm also a Communications and Media Manager for Southern Health. This year, I've been looking at how our staff feel valued. Recently, we celebrated in our July Star Awards, where teams and individuals are recognised for their outstanding achievements. Several staff have also received national recognition for their work this year, and we certainly have talented and highly regarded staff at Southern and are keen to retain them. We hosted our first Admin Matters Day this year, designed for all those working in admin to come together and discuss personal developments, opportunities, and their roles within the Trust. I've been impressed with our Freedom to Speak Up team, who are there for staff to reach out should they have any concerns within the Trust they feel they can't go to others about. Also, our health and wellbeing offers include physical and mental health support for our staff, including fast-track access to MSK and talking therapies. Finally, I want to highlight the work that we are doing to support our staff, to support carers, families and friends of our patients. By offering training and a network of staff carer leads, we are ensuring that our staff are equipped to support not only their patients, but the carers too, ultimately leading to better patient care and recovery. Thank you for listening, and back to Jenny now. Thank you.
Adrian, Venus and Sarah. What I'd like to do now is to approve the minutes of the last meeting. And hopefully you've all had sight of these, which have been on our website for a while. If you've got any queries or questions about minutes, please can you raise your hand using the hand raise option? No? Then okay, then I'll take these minutes as approved. Thank you everyone very much. Okay, what I'd like to do now is to introduce Ron Shields, who's our Chief Executive, for his review of the year. Ron, over to you.
Thank you, Jenny. Firstly, I want to start with a huge thank you for everyone who's associated with Southern Health, for all of the staff in the organisation, all 6,500 people, but also our governors, as well as all of the people who use our services and their families, everyone who contributes to the success of Southern Health. This has been another challenging year for our staff, still dealing with the back end of the COVID pandemic in parts, but actually more than that, actually the pressure that is existing on all of our services, all our physical mental health and mental health services have been under extreme pressure throughout the year. Staff, and we sometimes in some services have not got as many staff as we want, have done their very best to make sure that services are always continued and that services are delivered to the very best of the abilities that we have, always with compassion and always with the height of professionalism coming through. This is my third year in the Trust. It's my third annual general meeting. And I have to say I'm prouder than ever in terms of what I know that Southern Health and people of Southern Health do. There is so much that we do that is really, really good to serve the people of Hampshire and the Isle of Wight. We know that we can do better. We know that there are areas in which we have to do better. And there is an absolute determination that actually we will improve in all that we do. And that for me is the really encouraging thing, that whatever the difficulties we face, then we know that our people will rise to those challenges. Staff have been at their very best in dealing with difficult situations and being innovative in how they respond to some of the challenges that we face. Some of the things which have come about during the course of the year, many more are mentioned in our annual report, so I would encourage you to look to some of that detail. These are just highlights in terms of what I'll cover now. But our success at very short notice in setting up virtual awards and our urgent community response teams, fundamentally important to supporting people in their independence, trying to actually enable people to stay at home and to actually be supported at home rather than having to come into hospital to receive support. Very, very successful services during this year, very innovative, and showed us the way forward in terms of how we can develop other services in the community. The Southern Gambling Service, which you'll see about later, finding innovative and new ways, research, evidence-based ways of actually supporting people with addiction. Our NHS Talking Therapies, the Youth Intensive Psychological Support Programme, is a major initiative during this year. And again, it's the innovation of the teams bringing that together and finding new ways of supporting people with their psychological well-being. We've done, and you'll hear later about primary care and some of the work that we're doing in primary care. All of the trust services interface with colleagues who work in primary care, supporting people close to where they live. But we've also, in the course of the year, taken on direct provision of primary care services as well. So we now have quite an extensive number of services that we deliver where we are actually the provider of primary care. And that's likely to, I think, increase in the future as well. But our partnership with all of the practitioners who work in primary care, the GPs and all of the multidisciplinary teams, is one of the real strengths of the organisation. We've also done physical refurbishments of our facilities. We know that not all the facilities are as they need to be, but we are working through them. And this year we've had particularly large schemes at Melbury Lodge, at the Alton Community Hospital, and also Abbey Ward at Antelope in Southampton. So there are a lot of other schemes that we've done during the course of the year, but those are some that stand out. Also, something that we've been working on now for a number of years, and progress is not quick because it's a complex thing to do, and that is the Triangle of Care. We've been accredited for the work that we're doing in the Triangle of Care, and that's with our teams working closer and finding better ways to understand and to work with carers and to support carers in the work that they do, the devotion that they give to their loved ones, and actually providing support that otherwise would mean that people are in hospital. So those are some of the areas which actually we have made significant progress on during the course of this year. What is particularly important, I think, is the health and the well-being of our people, the people who work in this organisation and who work with us. And Satnam Sagoo will actually tell you later about some aspects of our people plan. It is central to our strategic ambitions. It has to be in that sense. How our people feel has a direct impact on the quality of care that's delivered. If we don't have enough people, if we don't have the right resources and support people in the right way, if people don't feel good in doing their work, then that will impact on the care that we give. We're making progress in those areas, in spite of what are nationally challenging situations in terms of recruitment, particularly of specialised staff. But we're also looking at how we can engage much more directly with our local communities and recruit more people from our local communities, and to offer the opportunities for people to have access to the professional training that we actually have available here in Southern Health. So I'm just going to move on now to a video which will show you some of the other highlights during the course of this year.
It's been another busy year for us at Southern Health NHS Foundation Trust. And in this video, we're going to take a look back at the last few months. During the 2022-23 financial year, our total income was £455 million. With that, we provided care to over 200,000 people, with over 1.3 million contacts with our patients. All this across a population of more than 1.5 million throughout Hampshire. In April, Amanda Pritchard, Chief Executive of NHS England, spent the day visiting our services. Amanda met colleagues at Lymington Hospital to see the Community Diagnostic Centre in action. CDCs are a flagship project for the NHS and aim to cut waiting times for diagnostic care across the UK. Amanda also visited Ashford, our specialist 10-bed ward for adult men with a learning disability who have been detained under the Mental Health Act. In May, we welcomed the Mayor of Alton, Ginny Boxall, and 2016 MasterChef champion Jane Devonshire to help us officially open Inwood Ward at Alton Community Hospital. The new 22-bed purpose-built ward has been created to increase the provision of rehabilitation and recovery in patient care in the area. In June, we celebrated Learning Disability Awareness Week with a week of activities and online workshops and talks, including an amazing animation by 19-year-old Sadie, who shared her experiences living with autism and learning disabilities. Southern Health was one of the driving forces behind Wellfest, the first ever Wellbeing and Inclusion Festival created exclusively for NHS workers and hosted by Hampshire and Isle of Wight's integrated care system. Up to 1,500 local NHS staff came together over 3 days to reconnect with colleagues and recharge over the most challenging periods in the NHS's history as a result of the COVID-19 pandemic. In August, Downton and Paddington star Hugh Bonneville visited Petersfield Hospital's Urgent Treatment Centre to mark the first anniversary of the centre's opening. Hugh joined the celebrations, commenting on the staff's continual commitment and dedication to the centre, which helps alleviate the pressure on local emergency services. The UTC is a 7-day-a-week, 365 days a year service. In September, our multi-agency stalking project was shortlisted at the National Positive Practice in Mental Health Awards. The project, which was featured on the BBC's Stacey Dooley Stalkers documentary earlier in the year, is one of only 4 programmes of its kind, and since its inception has worked with 69 stalking perpetrators and trained more than 1,400 professionals across health and criminal justice sectors in stalking awareness. November saw our health visiting service re-awarded gold status for UNICEF's UK Baby Friendly initiative. The service was highly commended by the BFI for the way care-related baby-friendly standards have been planned and implemented. In December, the Trust took on the running of Shakespeare Road Medical Practice in Basingstoke. The practice is being run as an exciting collaboration between Southern Health, Solent NHS Trust and North Hampshire Urgent Care. With primary care facing challenges nationally, it's hoped this innovative approach may support improvements. The Trust's internationally renowned Memory Assessment and Research Centre was awarded £156,000 from the Lewy Body Society to undertake a new study. Entitled Determining the Effect of Peripheral Inflammation on Disease Progression in Dementia with Lewy Bodies, the study, set to begin in April 2023, will improve our understanding of the causes of dementia with Lewy bodies. Building on recent success in developing therapeutic outdoor spaces, the Trust's charity Brightaway secured a grant of £143,000 to carry out further projects over a 2-year period. The project will help connect people, creating friendships and reducing isolation, provide education to grow and care for plants, create a source of healthy food, inspire people to eat healthily, and encourage volunteerism. In April 2023, the boards at Southern Health NHS Foundation Trust, Solent NHS Trust, Isle of Wight NHS Trust, and Sussex Partnership Trust approved a strategic case to create a new organisation for community mental health and learning disability services by April 2024. This work, called Project Fusion, follows the recommendations made by Hampshire and Isle of Wight Integrated Care Board's review into community, mental health and learning disability services. By joining these services into one organisation, we believe we will improve people's experiences and outcomes while removing some of the barriers to care that people experience. We are now expanding the level of engagement and communication about this work to ensure all our service users, communities and partners have the opportunity to be involved in this exciting project. All of this would be impossible without the unseen work our staff do across all our services, all day, every day, to provide the very best care they can to the people we serve.
Well, I'm sure that you can recognise their real progress and huge achievement across what is just a small cross-section of the services that we provide. I think importantly, all of the services that are not mentioned, the staff in all of those other departments and services who are doing a great job every day, who literally are doing the very best that they can do to support all of the people who come to us and in one way need the professional services that we have available. Really great effort from everybody involved in the most difficult of circumstances, and so much to be proud of. Looking forward, mention was made in the video about Project Fusion. There's another video in a moment that we're going to play which will give you more detail about Project Fusion. But this is bringing together the services of the Solent NHS Trust, the Health and Community Services of the Isle of Wight Trust, together with the community CAM services that are provided by our colleagues in the Sussex Partnership Trust, together with all of the services of Southern Health, to create essentially one large provider of virtually all of the community and mental health services for Hampshire and the Isle of Wight, serving a population of nearly 2 million people. There's huge potential that we have in bringing these services together. It's a great excitement for us in bringing services together. And what has been so pleasing is to see so many of our clinical services working so closely together, knowing that they can actually together provide an even better service for people of Hampshire and the Isle of Wight. So we'll just play this short video for you.
We are bringing together community, mental health, and learning disability services across Hampshire and the Isle of Wight into a single new NHS Trust from April 2024. These services will provide the wide range of NHS care that takes place in people's homes and communities and outside of big acute hospitals. Currently, these services are provided by 4 NHS organisations in the region. So why are we changing? Right now, we know that people across Hampshire and the Isle of Wight do not always have the same experience or access to our services. Using the NHS can be complicated and care can be split across different organisations. This can get in the way of you or your loved one getting the best treatment or support. Over the next coming years, the number of people using community, mental health and learning disability services will increase further, and we need to be prepared for this. We believe that bringing our services together will give us the best chance to improve people's access, experience and outcomes from these services, no matter where they live. Local services will still be delivered close to home in each area, but by sharing resources and expertise, we aim to improve the way services work to benefit our patients, communities, and our staff. Some of the benefits of working together include ensuring equal access to services and the same chances of recovery no matter where you live, improving access to care, especially to those most in need, a highly skilled workforce with improved development and career opportunities, improved patient experience, and an enhanced patient voice. Project Fusion is the name we have given to the work we are doing to put this new trust in place by April 2024. The creation of a new organisation will be a starting point from which we will continue to develop our services. It won't all be done by day one. We want to engage with people who use our services, their families, communities, our staff and partners to help us shape our new trust. You can find out more by visiting our website or emailing us. We want to hear from you. We are stronger together.
We really do want to hear from you. The Fusion as a project is a project that takes us through to the 1st of April. After the 1st of April, there is a new organisation. We don't yet have the name for that new organisation. Hopefully, we will be able to come to a name reasonably soon. But it is a new organisation. At the heart of that organisation are the values of the NHS and of public service, and the organisation and all of the people in that organisation, 10,000 or so people in that organisation, are working for and with the people of Hampshire and the Isle of Wight.
Thanks, Ron. And personal thanks from me for all the work that you've done over the last year. That's been achieved. Right, I'm now going to introduce Paul Anderson, who's going to take us through our finance report for 2022-2023. Over to you, Paula.
So I'm Paula Anderson, Finance Director and Deputy Chief Exec in the Trust, and I'm just going to spend 5 minutes telling you about the finances of the Trust this year. Ron and Jenny and others in those videos have already talked about all of the exciting, great things we've done over the last year, and obviously that needs to be done within a financial envelope or a set of income that we can manage things within. And it's really important. We have to manage our money just like we have to manage fantastic care and, fantastic corporate services. So I'm going to just tell you how we got on last year and tell you a little bit about next year. And I'm ready to go on to the next slide, if that's possible. Okay. So this is a slide that just gives a summary of the key numbers for this year and last year. Unfortunately, it's quite small and I can't see it at the moment. So that's a nightmare. Thank you. And this shows that we had income of just under 455 million for the year, which was an improvement on the year before. The income increase was due to funding things like inflation, which goes towards pay awards for all of our staff. But also it was recognising investments, some of the things that Ron's just talked about, opening Alton Ward, the community urgent response teams, the virtual wards, support that went into mental health. We opened two additional wards during the year around mental health, one at the beginning and one at the end, and I'll come on to that in capital. But all of that required additional investment. And mental health is protected by an investment standard that means that it has to grow at the same growth rate that the NHS is growing at. So with an additional 0.5% from memory on top. So it's a really good protection for mental health services. And nationally, there was a lot of support for community services, recognising the pressure on the system that coming out of COVID was for all of us, really. We ended the year with we planned to break even in year, and then towards the end of the year, we aimed to deliver a surplus. This was partly to recognise that actually other parts of our system were really struggling to hit their break-even position. And so we tried to go a little bit further, which brought down the overall overspend that occurred within Hampshire last year. That we managed to achieve that through non-recurrent means, and it's
as you can imagine, it is a real balance trying to manage hundreds and hundreds of services. All of those services are trying to balance within their own financial constraints. And every effort that people go to every day to make sure that we don't spend more than we need to is what delivers this result, and it was fantastic. As you'll see, there is a big technical adjustment in there, which is impairments. It's a technical accounting term. It doesn't have money attached to it, so you don't have to pay somebody for it. But it just means that we're compliant with national accounting standards. But the real figure there was the 1.5 million surplus. That's the one that counts in terms of the NHS bottom line. I think we can go on to the next slide. I've covered some of this. This is some of the other key highlights. So the agency staffing spend was one of the real struggles for us last year and continues to be this year. We're incurring significant costs on agency. That's for a combination of nursing staff and AHPs and healthcare support workers, as well as medical locums. And some of that was around new capacity. So I mentioned earlier that we'd opened Cherry Ward at the beginning of the year, which was in Parklands Hospital. Towards the end of the year, we opened Abbey Ward, which is a female PICU unit in Antelope House. And we also, as shown in the film earlier, opened Alton at the beginning of the year. All of those needed capital expenditure to make them happen, to make the building and the premises a good place to be, but also obviously required additional staffing. Trying to step up that level of staffing in year was hard, and we needed agency staff. We continue to use agency now, and it is one of the areas that we're really trying to target in terms of trying to get substantive staff numbers increased with less vacancies, and trying to use less unplanned agency support. We were trying to hit the 95% target on paying people. So it's really important that we pay people quickly, because small businesses, medium-sized businesses that are in our local area that are supporting us by delivering services or products need to be paid promptly. And unfortunately, we missed that slightly this year, and it is a regret. It's not something finance departments like to miss. And we're working hard to improve on that this year. There was delays in the contractor that the partner that we work with, who helps us process invoices, but we want to improve on that this year, and will do. We did deliver a cost improvement programme. It's always the requirement within the NHS that partly it's set into the national picture. When they give us inflation funding, they also say, actually, you need to deliver something on efficiency. We know that nationally we've struggled to get back to productivity levels that were seen prior to COVID. It's particularly hard within the acute sector, where their delivery of care has been really impacted by COVID, and they're struggling to get back to those levels of productivity. So the savings requirement on us this year and next year and the next couple of years is even greater, because national funding has gone into increase resources, but they need to bring it back now to the resources that were planned for this period of time prior to COVID. The IFRS 16, I won't talk about in detail, probably because I'd struggle to, but it's very technical and it's an accounting standard. And it's important that we stay, NHS Finance has always stayed very in line with accounting standards. So it's accounted for in a way that you would expect other organisations to. And that was a big job for all organisations to do this year, and we successfully got through that. It means that finance leases are now on our balance sheet as sort of an asset, and a liability. So it was quite an important change for us. And next slide, please. Our capital spend, I think we've mentioned many of these already, particularly the buildings. So this is the work that we do to spend money on things that are going to stay with us for a while. So it's not an in-year spend like salaries or like gloves or rent on buildings. It's actually the building costs of refurbishment and keeping them up together, and opening new wards, and all of our digital support and medical equipment. So I think we've mentioned many of the premises improvements there, but actually on our technology, we're always moving forward with the technology and trying to get new systems in place that support our staff to be able to care and care with the best resources they can. Example of that is Rio Mobile, which enables our teams to be able to use Rio when they're out and about seeing patients, instead of it being a sort of very fixed thing that you have to come back to the office. E-observations is another thing where we're trying to use technology to support staff in being able to record observations in a timely way, but also be able to record it consistently. And our capital spend last year was 15.3, so significant. And the next page will talk about cash, I should imagine. We've still got a strong cash position. You can see a bit of a breakdown there, but we were at the end of the year at about 45 days of operating cash. It decreased slightly, but that was expected. And we're still in a really good place with cash. Cash is one of those things that we all know how important it is from our personal experience, but it's also one of the things that allows us to spend money on capital schemes. We are restricted with that. So just because we've got 45 million doesn't mean we're allowed to go and spend 45 million on capital. There are other constraints that are built in, including an ICB level resource envelope. But it's important that we've got the cash. It enables us to pay people quickly, and it enables us to do our capital. And the next page, please. Brightaway is our charity, and we've continued to see being able to get grants from NHS charities together, as well as our hospital friends at Lymington and other League of Friends that are associated with other hospitals such as Gosport. Our staff raised money. We had a bit of a competition going at one point to see which division could raise the most in donations, and people did great stuff. So we did raise new £200,000 last year, and as you can see, we committed some of that towards grants, which are mentioned there. It's a really important part of what we do, the charity, and it just enables us to stretch the NHS resources a little further. And the next slide, please. Thank you. So that was the old year, and we ended on surplus, which we were pleased to do, and it's quite unusual, but it was also against a backdrop of a system that we are struggling with in Hampshire and the Isle of Wight, and you know, those of you that are following the local correspondence will know some of that. We have submitted a plan for this year to break even. We're doing that despite the fact there is a significant amount of pressure in the system. Other organisations have found it really hard to meet a break-even duty this year, but we are trying really hard to do so. That's as well as obviously the investment we've needed to make this year in supporting Fusion, which has a cost attached to it this year, as we sort of develop all of the plans that we need to get a successful case, but also a successful integration and implementation plan. We have been able to attract additional income this year, which has been really positive, particularly around mental health. And we continue to use that to develop the No Wrong Door programme, other areas of investment that have been prioritised by the system. We're managing risks at the moment. That includes the risk of not being able to deliver the full target on our cost improvement programme, 25.3 million, which is the largest programme we've ever tried to address in this trust. And we know we can't do all of that recurrently. Some of it is non-recurrent, so it's a one-off, which means we'll need to find another way of providing for that next year. But it is a challenge. So far, as of today, we're on plan, which is a small deficit, which was as planned, and we will recover that over the remainder of the year. The system generally has needed to go into a recovery support programme this year, and because of that, there are enforcement undertakings that we are a part of. It's all organisations in Hampshire. We are trying our best on this to stay break even, and to make sure that we fully engage with transformation programmes that the ICB are coordinating that are aimed for all trusts. So definitely another challenging year ahead of us, as well as last year. But all of our teams, I thank you from me for everything that you do as members of staff that support this. We all know that, you know, it's easy to manage one thing, but having to manage everything and the money is a real challenge, but it is what we're here to do. So I'd like to say thank you. Thank you for everything you do. Thanks for the support that you give to my teams when they're trying to understand what's happening. And I'm always here if people want to talk to me about the money or want to understand a bit more or want access to a bit of training, we can always do that. So just remember to get in touch if you need to. Thanks for everything, and hopefully another good year this year on the money. So well done, all of you. Thank you.
Thank you, Paula. Now I'd like to switch to our external auditor, Thomas Wilkins, who's going to join us from Ernst & Young. Thomas, over to you.
Just by way of introduction, my name's Tom Wilkins. I'm a senior manager working with Ernst & Young. We're your external auditors. As external auditors, we are responsible for expressing an opinion on various items. So the first of those is your financial statements, in this case for the year ending the 31st of March 2023. We're also responsible for expressing an opinion on parts of the remuneration report, and looking at the consistency of those financial statements with other documents. So that would include your annual report and the consolidation schedules, which are provided to the National Audit Office. We report by exception in a number of areas. So that would include in relation to the Trust's governance statement, where that doesn't comply with guidance or where it's inconsistent with our own knowledge. We'd also report by exception if we have concerns around the legality of transactions that we identify, or where we think the Trust is making decisions which may be illegal. And we also report by exception if we identify a significant weakness in the Trust's arrangements to secure economy, efficiency, and effectiveness. And we'll talk a little bit about that in a moment. So if you just want to skip on to the next slide, I'll talk us through our financial statement audit. So in terms of the opinion on the Trust statements, when we are planning our audit, we think about where there may be fraud involved in preparation of the financial statements. And in the Trust's case, we considered that there might be management override of controls. We thought the management might manipulate the financial report performance of the trusts to give them a desired outcome. And we considered that they might look to capitalize expenditure, which should not be. We didn't have any significant risks, but we did have a couple of areas of audit focus. So that's the valuation of the Trust's land and buildings, the implementation of new accounting standard, which Paula touched on in relation to leases, and then in relation to the Trust's going concern. So we completed our work around that, and there was no evidence of material misstatement arising, and we were comfortable that the accounts were fairly stated. So next slide, please. So like I said, we also do some work around value for money. This is typically backwards looking, but we report against 3 criteria. So the first of those is financial sustainability. The second is governance, and the third is the Trust's ability to improve economy, efficiency, and effectiveness. When doing our assessment, we look to identify risks of significant weakness in arrangements or whether there are any actual weaknesses in arrangements. And I'm happy to report that we didn't find any across any of the 3 criteria that were reported. So we didn't have anything to report in respect of value for money. There is some detailed commentary which we released, and that's included within our auditor's annual report, which will be on the Trust's website. So if you want to skip to the final slide, please. So just in terms of wrapping up, we're intending to hold meetings, and we've got them diarised with both Paula and members of the Audit Risk and Assurance Committee, just to wash up where we got to last year, and then think about how we look forwards to the next financial year and all the things that come with it. But I think the big thing from us is to say a huge thank you for everybody at the Trust, particularly the finance team, for all of their hard work last year and supporting all the work that we did to get through the audit, and we really, really do appreciate that. So thank you.
Thank you, Tom. Thank you. That was great. Right, we're now going to move on to take some questions from the audience, and thank you to everyone who taken the time to put some questions in. I'm going to introduce Sue Glenn, who's going to be chairing this session. And if anyone still would like to ask a question, please do enter it in the chat in capital letters so we can pick them up.
Right. Hi everyone, thank you for your questions. I've got 3 questions at hand, and if you have any other questions, please do put it in the chat in capital letters so that we can address that. So the first one is for you, Satnam. It is about the fact that we sometimes struggle to celebrate and share some of the brilliant work that goes on in our services. And we heard about Project Fusion, there was a lovely video. So the question really is, how will we ensure that we can do this in a larger trust?
Great, thank you, Siva. I think one of the things that we're doing this year is very much focusing on that piece around recognition in our part of our people plan, which you do get to hear about. And I've got a short bit that we'll talk about in a little while, but really that focus on that recognition from things like that we've already shared with you around the Star Awards, but really that local recognition on a sort of, you know, what's happening. So there is a stronger focus than ever before on that recognition piece and how to have those champions. And our view is as we go forward into the new trust, there is going to be a much more stronger focus on creating that opportunity to have a great people experience. And part of that is really thinking about the opportunities we do to ensure that people thrive and flourish and succeed within an organisation. And part and parcel of it is that celebration of individuals, ensuring that our managers recognise that and recognise the sort of small acts of kindness as well as the large awards as well. So there's more detail in our people plan, but definitely something that is a key focus for us.
Thank you, Satnam. I think it's, again, I just want to attest to the fact that we talk about this and we just talked about this morning in the committee. So thank you. It's definitely something that we keep an eye on. The next question is about value for money. And I think, you know, Paula Anderson, this one's for you, definitely within your wheelhouse. But also, I think just want to go back to the fact that we heard from our external auditors. So hopefully that gives the people who are asking the questions some assurance as well. The question is, Paula Anderson, if you're ready, with the coming together of the trust, how are we going to audit and govern the procurement system to ensure that we are getting value for money?
Yeah, thank you for that. So there's lots that we do within the trust to try and make sure that that's achieved, and that's part of our normal processes. To be honest, if we're there are numerous ways that you can buy things if you're within the NHS. Sometimes you go through catalogues, which are a standard thing that are allowed, that have been determined nationally, so that in theory you are getting the best price you can. Sometimes you work off frameworks where people have put really specific items onto framework where they've done all the testing for value for money and there's a validity to it that says actually this is okay. And then sometimes we'll go out to tender and we'll do our own piece of work that says what does our team need? Why do they need it like that? And we'll really test that. Then we'll go to the market to try and get whatever it is. And often it's a service. And then we can test that against other organisations. So if 5 or 6 people say, oh yeah, we can do that, we can provide that for you, then we can test how their specification and their cost sits within a framework that we design. We do all of that work within Southern, and it's the sort of thing that the auditors will have looked at on a regular basis. But we're also obviously working with our colleagues now in Solent and the Isle of Wight. And the way that we're working is that we've got a steering group that covers this area. And over the next 6 months, as we get towards the 1st of April, we will start to bring our processes together and say, okay, who do we think's got the best process for these things? And we'll try and get best practice that can go further than the 3 organisations. If best practice is being provided, you know, somewhere else, then let's have that best practice. But that's the intention. Work with our teams now to make sure that we get the best processes in place that we can. And that will then be a really great place to start from next April. But thanks for the question.
Thank you, Paula. A great answer as well. The next question is something that's very dear to my heart. So whoever's asked that, thank you very much. What sustainability and energy saving projects are being developed in line with Fusion and the bigger picture of the NHS promise of net zero carbon? And this one, I guess, Heather, you're the closest to it. So please, could you share your thoughts on that?
Thank you. Thank you. So, yeah, we've obviously are committed to the NHS net zero commitment, and we've developed our green plan, as have the other organisations across Hampshire and the Isle of Wight. You know, this is obviously a whole system approach. Fusion's part of it, but we need to do it across the whole system. And we've been developing projects around things like buildings and our energy use. So moving over to make sure that the lights turn off, that we're moving away from our reliance on gas and switching to alternative heat sources, reducing our energy. We've switched over to 100% of electric bought from green suppliers. We've been doing things around travel, so working in where we are tonight with this kind of virtual meeting has really enabled us to cut down travel costs and therefore the impact of travel on the environment. And we've introduced a lease car scheme for staff to buy electric vehicles or hybrid vehicles, which is proving really popular. So we've been putting in the infrastructure to enable staff to be able to charge those at work and make that an easy option for staff. So that's a salary sacrifice scheme. And as I said, it's growing in popularity. We're looking at our water and our waste consumption. We've been doing some significant work around the catering department, switching over to reduce plastic waste within the catering. And we've put in a new system so we can really monitor food waste and minimise that as far as possible, as well as working with local suppliers. And our work with all of our suppliers across our procurement is going to be important because such a lot of our green footprint depends on the sustainability of the products that we use across our services. So that's going to be a key part of the strategy going forward. So there's an awful lot going on. There's an awful lot to do. We know that we're probably picking the low-hanging fruit and things will get increasingly more challenging as we go forward. But we are continuing to look at, you know, new ways that we can enhance our sustainability.
Thank you, Heather. I just have to say it is immense. There's a lot of work to do, but definitely there's lots going on already. The next one, again, another brilliant question. Thank you for asking this. Paula Hull, this probably is definitely within your wheelhouse. The forthcoming NHSE transformation programme for cultural change within mental health, learning disabilities and autism inpatient wards require a significant shift in how we work with people. To make the changes, psychological safety within teams is paramount. We are expected to be a trauma-informed organisation, but how do we ensure that compassionate leadership and trauma-informed care is embedded across our services from floor to board and board to floor? Just before you get in there, Paula Hull, I just want to say that, you know, pretty much every meeting that we have with Paula, she raises this. So this is something, you know, I'm sure she's well placed to answer. So Paula.
Thank you. Thanks for raising this really, really important item. And I guess there are several different elements to it, but I'll start with my interpretation, which is this is about leading by example. It's not something that is a narrative or a policy. This is something that you have to do and you have to be. And it's every single person, particularly people in leadership positions, particularly our board, understanding the sorts of environments that we need to create to enable people to be their best selves. And some of that for me is about being human. It's about recognizing that as humans, we're not fail-safe. We make mistakes. And when we do, there's a certain way that we'd like to be treated. It's really, really important that we create an environment where when someone makes an honest mistake in what they're doing, that we treat them with compassion and care. And the way that each and every one of us acts, speaks, and reflects on the organisation itself and the way that we do this. So for me, it's about kindness and it's about listening. It's about being human and not getting caught up in processes and policy or getting caught up in politics or bureaucracy. It's about being human with each other every day and testing ourselves and being honest about whether or not today we've been tolerant of everybody that we've worked alongside, that we've been kind, that we've acted within our values, and that we've created an environment where people can be their best selves, not be fearful about making mistakes. And for our service users and communities and families, really important that we don't re-traumatize them by not understanding their experience that they've had and the impact that has had on them. So some of this is about not making assumptions, not thinking that we know best because we're professionals. It's about listening and giving people choice, respect, and honesty. And of course, you will not be surprised that behind me, there is a rather large poster that is the ABC strategy for nursing and allied health professions, and actually across all of our services, which is all about compassionate leadership, the A is for autonomy, being able to make decisions about the care that you're providing and the care that you're giving to people. It's about belonging, being part of a team and feeling valued. And it's about the contribution that you make and knowing that even when you make mistakes, because you will, because you are human, that we will be there alongside you to help you learn and to treat you with respect and value you. Really important question. Thank you for raising it.
Thank you, Paula. Again, you know, that depth of answer was just testament to show how you're leading the clinical colleagues in showing up for our people. So thank you for that. The next question really is a testament to the times that we live in, right? So this is all about cyber and digital apps. So this one's for you, Heather. It's a two-part question. So I thought since you are here to answer, we'll give you both questions at the same time. So the first question is, how is the trust managing the risk of hacking? As we are in a state of cyber war, cyber risk definitely is on the risk register of most organizations. The second part to this, and I think a couple of people have asked this similar questions in a slightly different way, is, you know, how are we using the NHS app for appointments? Is that something we're doing? And is there a mental health app that we should be considering? So two parts to the question.
Thank you. So I'll deal with the cyber one first. So it is an area we take extremely seriously. And I'm pleased to say, actually, it's also an area where we benchmark quite well nationally. So we are one of the trusts which has gone through the Cyber Essentials Plus accreditation, which is where we have to hold ourselves up against a series of benchmarks to check the processes that we have in place around managing our systems to make sure they're really robust. So there's things like, two-factor authentication, which quite recently we recognise has protected us from, a recent hacking attempt, which impacted other organisations. We've also got the Data Security and Protection Toolkit. And again, we've exceeded expectations on that this year, which, is really good and gives us some confidence that the teams are working really well to manage our networks and our systems in a way that gives the most robust protection. But of course, with hacking, it is down to every individual understanding their responsibilities around this. So, making sure those phishing emails are deleted, that you're not clicking on attachments, that you're protecting people's information. So we take our training of staff really seriously and hold ourselves up to a high level. And again, that sort of training level is part of what has given us that rating of exceeds expectations in the Data Protection Security Toolkit. So, you can't not be vigilant in this area, but it is an area that we do take seriously, and we do review our standards against. The NHS app, obviously that is a growing area of access. It is an area that I think we need to have a look at what it can offer and what our opportunities are. I think if you were to ask me where we need to develop more, it really is around those patient portals and the ability for our patients and our carers to be able to interact with our services in an easy and digital way, to book appointments, to interact with clinicians who are supporting them. And I think that is an area that we need to develop. One of the things that we've been doing around children's services is doing the parent portal, and that's proved really popular. So we'll be taking some lessons from that as to how we can roll out more of that direct access to services around booking appointments, ordering prescriptions as we go forward. And it's absolutely a key component of our digital strategy.
Thanks, Heather. And I think we've got some kind of feedback on the fact that it has been helpful for everyone, right? So thank you for that. Coming to the last couple of questions. So this one's for Eugene, and it's more of a reflective question, if we're allowed to indulge in that. So of all the many challenges with lots of improvement evidence, what are you most proud of?
Yeah, thank you. Really difficult question to answer because there is so much to be proud of actually in the trust at the moment. I would say probably if I was to be asked, as I am, the specific area, it would be about how we're rising to the challenge each and every single day. You know, we've got, as we've heard today, so many new initiatives, changes and developments going on, and yet we've got patients who are looking for us to provide the very best care every single day, and we're able to manage those challenges and changes and new initiatives whilst providing that effective care, making sure that that individual is our primary and only concern, even though we've got so much else going on around us. And I think that's a real testament to our staff, that they're able to rise to the challenge, able to stretch themselves above and beyond every single day, and to make sure that our patients are at the centre of what they do. And I think they do that in all of our services. There are so many testaments that I can bring forward to evidence that. And I think that's what I'm most proud of, actually, our staff and what they do every single day. Some of which we don't recognise as much as we do. And I think that was in the chat also. How do we celebrate that really great practice, that basic care, that fundamental of care that we do in all of our services each and every day? Thank you.
Thanks, Eugene. I would like to echo that. Actually, it's people showing up every day, with that passion and that purpose to be here for all of us in the community. So thank you. Last question of this kind of segment, if that's all right, or we might have another one. But Paula A, this is a pertinent question for you, all about the money. How much are we spending on agency nursing? Because the experience on the ground is that people might not necessarily see the same person. So what are we doing about it? How much are we spending? Perhaps Paula, Paul, you might be able to kind of give your views as well.
Yeah, thanks for the question. So last month we spent, obviously it's a summer month, but we spent £1.2 million on agency nursing and healthcare support workers and AHPs. And they're a really important resource for us. We need to keep our services safe. And for things like our inpatient wards, if we haven't got enough staff, then it's a worry, isn't it? And we need to rely on temporary staffing, which we do. And we are very grateful to our colleagues that come in to work with us on a temporary basis. Obviously, though, we would rather we had less vacancies and more substantive staff. And if we are going to use agency staff, then we want to make sure it's good value. And so trying to make sure that we use networks and agencies that are not off framework, which is sort of technical way of describing, slightly more expensive. It's really important, isn't it, that we have agency staff that we know that they've been trained properly, that they've gone through an induction, and all of the safeguards are in place that you would expect, and that we're not paying more than we need to for them. Paula, as Sue has already mentioned, Paula and colleagues have shown so much leadership this year, working with our teams around agency. And because of that, we are seeing improvements. I would say we're seeing greater numbers of people being using our bank service, which is obviously staff that spend more time in the trust and are quite frequently on shifts. And we're paying less for our agency staff, but still being able to get the quality that we need. And that's the sort of the leadership from Paula and her teams and the nursing teams throughout the organisation. Don't know whether you want to add to that, Paula.
I think you've covered everything, Paula. Absolutely.
Perfect. Do you know what? Like, we could go on and on with the questions, but I think we've got another segment for it. So there's still more information that we want to share with you. So thank you for your questions, and thank you to the exec for all of your amazing answers. We've even got somebody who's saying, tell Ron he's doing a good job. So, you know, we've just told Ron. So I'll pass you on to Jenny to take us through the rest of this evening.